welcome to another Deep Sea Foundation YouTube video. My name is Terry Kuti. I'm the founder and director. Today we are in a wonderful exercise facility in Ohio, and I am with Laura Leach, who is a trained exercise physiologist. I'm also with my demo wonderful friend here, Mary Buchanan Moore. Mary and I have both had the same type of breast reconstruction, which is deep flap using the lower abdominal tissue. And so the first thing I want to say out of the blocks, viewers, do not do any of these exercises at all until you consult with your physician. In fact, all of us here have agreed, feel free to take this YouTube video with you to your physician and show them and say, am I released to do these exercises? But I have many women that ask me about regaining their core strength after this surgery, because with deep flap you have a hip-to-hip incision, and there's a false sense of, gosh, I've got my tight tummy, almost like a tummy tuck. You still have those muscles, the rectus abdominis muscles. You still need to keep your core strong. So that's what Laura is going to walk us through today, and I'm going to let them take over and step out of the video for just a minute. But again, ladies, please ask your physician before you do any of these exercises. Okay, Laura?
Okay, great. All right, we're going to start off first with a simple pelvic tilt exercise. You can see Mary has her knees bent. She's lying down on the floor. When you're lying down on the floor, such as Mary is, you may notice that there's a slight gap in your low back, between your back and the floor. We want to basically get rid of that gap. So she's going to flatten her back against the floor, so bring her belly button to her spine, and she's tightening up her abdominal muscles. Okay, and then she's going to relax, and then she's going to do that again. So we typically would recommend doing a set of 10 of those, okay? One thing I want to point out in any of these exercises, I want you to make sure that you've got your shoulders relaxed, so your shoulders are away from your ears, and we don't want you bringing those up and tightening. The focus is right on the abdominal area. Something then, a way to progress with this would be to go ahead and do that pelvic tilt, so she's tilting the pelvis and then actually holding for 5 to 10 seconds. The hard part about that, and Mary knows, is you have to breathe while you are doing it, okay? So you're also gonna help work some of those deeper abdominal muscles as well. And this will definitely help connect the pelvis area to the core again and really get that abdominal area activated. Once you're able to do pelvic tilts and you really feel comfortable doing those, you're not having issues with those at all, a great next step would be what we call a tabletop. So with that, Mary is going to go ahead and bring her knees up, okay? What she's going to do is go ahead and make sure she's flattening her back or tightening up those abdominal muscles. And a really simple exercise from there would be to just move her arms back and forth, such as what Mary's doing right now. So she's keeping that abdominal tight, so she's keeping that brace is what we like to call that. If at any point in this exercise you notice that your lower back is coming up off the floor and it's arching, I want you to stop and I want you to re-brace, okay? You may notice those abdominal muscles are kind of weak, so we want to make sure that we're keeping that so we're not causing any low back pain. Great job, Mary. So you can relax a second. Something moving forward from this particular exercise would be if she goes ahead and brings her up to the tabletop again. A great next step would be taking a 3 or 5 pound weight and actually bringing that over her head and then back again. If you don't feel like you've got the range of motion in your shoulders to bring it back very far, that's okay. Only go as far as what your shoulders feel comfortable doing. Okay, but again, she's keeping that tilt, her back is flat, her abdominals are tight. Very good. All right, awesome. Take this from and you go and relax a second, Mary. So with those 2 exercises, those are kind of preliminary beginner type things to do, but I want you to start with those first to make sure you feel comfortable. And next step from that would be doing the tabletop again. Again, she's flattening out the back, keeping the abdominal brace, and then what she's gonna do is just tap one foot on the floor, one at a time. So this is really gonna tune into that lower abdominal pelvic area. So again, if this causes any discomfort, any pain, you may wanna go back to doing the other exercises for a while before you move forward. Great job, Mary. Now have you go ahead and put your feet back down. Last but not least, we are going to do a bridge. So this is one where Mary's gonna lift her hips and her rear end off the floor. Okay, and we're gonna hold, and then she's gonna come back down again, and we're gonna wanna repeat that. You know, with a lot of these, we tell people usually 10 to 15 reps is good. Start off with one set, see how that feels the next day, and then moving forward, you could even do these 3 times a week or so, and even move up to 2 to 3 sets of those if you would like. But you can see when Mary's coming up, she's focusing on tightening her rear end. You're also gonna notice some tightening in that low back as well. Very important that if we're strengthening the abdominal area, we wanna make sure our glutes and our low back are strong as well. Great job, Mary.
All right, again, hey, high five right there. Good job, Lauren. That was a great explanation, and I want the viewers to know again, this is a pre-surgery and a post-surgery exercise routine that you could do. Again, only if you check with your physician. Feel free to take this video with you to your healthcare team and ask them if it's okay if you start these. Again, it's strengthening that core area. I know that I have done these exercises and have noticed a huge difference. Mary and I talked about this in the lower back pain, right? You've seen benefits in that too, so it helps with that. Strengthen your core, you get that lower back pain alleviated. If you're doing them properly, Laura did a wonderful job of explaining that. Thank you so much for watching the Deep Sea Foundation YouTube channel. Be sure to like and subscribe, and let us know if there's any topics you would like us to cover. Thank you so much for joining us.